10 early warning signs your feet might be telling you about diabetes. Diabetes often reveals itself quietly, and your feet are usually the first to know. Below are 10 early warning signs in your feet that could indicate diabetes, each expanded with robust detail, clear descriptions, and emphasis on how each symptom is directly tied to this chronic condition. Tingling or burning sensations. A persistent pins and needles feeling, electrical jolts or burning sensations in your feet, especially noticeable at night, can be one of the first signs of diabetic neuropathy. This condition arises specifically from prolonged exposure to elevated blood sugar levels, which damages the peripheral nerves. It usually begins in the toes and gradually spreads up the legs. Many people describe it as a buzzing feeling or the sense that their feet are on fire, even when resting. These sensations are not random. They are directly linked to how diabetes silently harms the nervous system over time. If ignored, the nerve damage worsens, possibly leading to complete loss of sensation and a heightened risk of unnoticed injury or infection. Numbness or loss of feeling. If you notice that your feet often feel numb, or you can't sense touch, pressure, heat, or cold, this could be a clear indicator of advanced diabetic neuropathy. Numbness occurs when high blood sugar levels, sustained over time, impair the nerve's ability to communicate with the brain. This sensory loss is more than discomfort. It's a hallmark of diabetes-related nerve deterioration. As the disease progresses, the lack of feeling increases the likelihood of sustaining injuries you can't feel, which can become serious or even lead to amputation in unmanaged diabetes. This makes numbness one of the most critical warning signs to catch early. Slow healing cuts or sores. High blood sugar interferes with circulation and immune response, both of which are essential for wound healing. In people with diabetes, even minor injuries to the foot may linger or worsen due to restricted blood flow and delayed tissue repair. If you notice that a small scratch, blister, or nick on your foot takes unusually long to close, it's often because diabetes is impairing your body's natural healing abilities. The longer a wound remains open, the greater the risk of infection. This slow healing is a direct consequence of diabetes and one of the most visible signs that your blood sugar may be out of control. Foot ulcers or open sores. Foot ulcers, especially those that develop without pain, are often a red flag for undiagnosed or poorly managed diabetes. Diabetic individuals may develop these ulcers due to a combination of peripheral neuropathy or nerve damage and poor circulation. What makes this symptom especially dangerous is that it often goes unnoticed until it becomes infected. The ulcer may begin as a small sore or callus that worsens due to pressure and an inability to feel pain. In diabetics, these ulcers can become chronic wounds that lead to serious complications if left untreated. Identifying foot ulcers early is crucial for preventing long-term damage and maintaining mobility. Changes in skin color or temperature. Diabetes can damage blood vessels and impair circulation, causing noticeable changes in skin tone and temperature in the feet. You might see your toes turning bluish or pale, or feel that one foot is colder or warmer than the other. These symptoms are not just cosmetic. They indicate a lack of healthy blood flow caused by diabetes-induced vascular changes. Infections can also cause localized redness and warmth, especially around an open wound. Recognizing abnormal temperature or color shifts in your feet can help detect complications from diabetes before they escalate. Swelling in the feet or ankles. Diabetic patients are more prone to this due to issues with circulation, kidney function, or heart strain. All of these are common diabetes-related complications. This swelling, known as edema, may occur gradually and is often accompanied by tightness in shoes or visible imprint marks from socks. As high blood sugar weakens blood vessels and causes fluid retention, this swelling becomes more than a discomfort. It's a symptom of systemic damage tied directly to diabetes. Monitoring changes in foot size or shape can help in early detection and management of the disease. Dry, cracked skin. Autonomic neuropathy, a type of nerve damage caused by diabetes, affects the nerves that control sweat and oil production. As a result, diabetics often experience excessively dry or cracked skin on their feet. These cracks can serve as entry points for bacteria, increasing the likelihood of infections, especially when combined with poor circulation. While dry skin can occur for many reasons, its persistence in diabetics is a direct effect of damaged nerves and impaired hydration regulation. Proper foot hygiene and moisturization are important, but it's even more important to understand that these skin changes often originate from uncontrolled diabetes. Thick, yellow toenails. People with diabetes are more likely to develop fungal infections due to weakened immunity and reduced blood flow, making thick, yellow, or brittle toenails a common foot symptom. These changes are caused by fungal overgrowth that thrives in diabetic environments where circulation is impaired and healing is delayed. The nails may appear discolored, become painful, or separate from the nail bed entirely. What sets diabetic nail infections apart is their persistence and resistance to typical over-the-counter treatments. Their appearance can be a subtle but powerful sign of underlying blood sugar issues. Fungal infections between the toes. Recurring athlete's foot or other fungal skin infections in the toe spaces can be linked to elevated blood sugar levels and weakened immunity in diabetic patients. Diabetes alters the skin's barrier functions and creates an ideal environment for fungal organisms. Cracks between the toes, peeling, and persistent itchiness can all be signs of an underlying issue that goes beyond basic hygiene. Left untreated, these infections can create entry points for more serious bacterial infections. Their recurrence is often tied to poorly controlled diabetes, making them both a symptom and a consequence of the disease. Loss of hair on feet or toes. Hair loss on the toes or feet may seem minor, but in diabetics it can be a key indicator of poor circulation, a direct consequence of long-term blood vessel damage from high glucose levels. Hair follicles rely on adequate blood flow to stay nourished. When diabetes narrows and hardens the arteries, these follicles no longer receive the nutrients they need, causing gradual hair loss. If you've noticed your feet becoming smoother, shinier, and hairless without shaving, it may be more than aging. It could be a vascular warning sign from diabetes that needs prompt evaluation. Each of these signs is your body's way of warning you. Paying close attention to your feet and seeking medical advice when changes appear can help you catch diabetes early and avoid serious complications. Always consult a healthcare professional if you notice persistent or unusual changes in your feet.